I'm a terrible disruptor in the market from the point of view that I tend to only believe what I believe myself, and most of the stuff that people tell me I really take with a pinch of salt unless proven otherwise. So I mean, our way of treating at retrobulbar came from that paper with a colleague of mine, of course Jean Carruthers, who was warranted with being one of the first people to use Botox, I suppose, for wrinkles. And Jean had sort of said, okay, because she's an ophthalmic surgeon as well, to use the retrobulbar technique. At the time, I had said, and in literature as well, that this probably won't work. And the only reason that ophthalmic surgeons are telling us this is because they use that as anesthesia for cataracts, blah, blah, blah. So the problem was that it's in a different compartment. There's only 3 millimeters of dura mater, the sort of there, and I mean, you're embolizing the central retinal artery, you know, which is way back out of that area altogether. So, you know, I wrote back then, I have my reservations about the retroorbital method, and I proposed that it should use the supraorbital route instead. It's very easy to palpate, anybody can reach it. It's a direct source back into the sort of, where the problem is. And, you know, I sort of had written that at the time. We did a literature search in 2022. There isn't evidence that retrobulbar technique worked in one patient. There's one by a colleague of ours called Chestnut that sort of claims that it might have worked in his instance, but after 2 minutes when it didn't work, he used the supraorbital and then it worked. So he's using 2 techniques. So who's to say that it wasn't the supraorbital that worked? So you know how to palpate that. It's very easy. And it's the medial border of the iris where your supraorbital foramen is. So you can pop it there, put the needle straight into it. If you're not brave enough, just put it above it. If you think it'll transect, the supraorbital nerve comes through there as well. We do it every day, of course, doing blocks for hair transplant, doing blocks for laser resurfacing. So it's just quite easy when you get up and running. And I had given a lecture 10 years ago now, 9 years ago, saying that that's the method that should be used. I'd written to Prime regarding that as well. Vegas, I sort of, again, was kicking off that it should be using that. And then we had our first case of reversal back in 2016 with Mike Clegg and Greg Goodman in Australia. And since that, we've had about 6 cases of reversal. This is a case that I was involved with in Sweden. And unfortunately, that patient did end up losing her sight. But at the time, we were going to try stem cells because stem cells had worked on heart tissue, but they hadn't worked on, I suppose, nerve transections in the back. But they certainly worked for dying myocardium. So this patient we're going to send to Miami originally, and there was talk of a patient that was in Miami that had got better reversed, and I discovered she was MS. So, I mean, that just doesn't work. MS, you get relapsing blindness. You know yourself, you get remission and relapses all the time. So it made no sense. So then, in the terms of the Carlisle Institute, we looked at Alex Skupin, and Miami, he wanted to do it then in the Dominican Republic. And believe it or not, this doctor that you've seen, I suppose, on Netflix with his series, who got struck off, Paolo Macchiarini, we had invited him to the Royal Society of Medicine, believe it or not, with his Turkey one, but he'd given false results, and he really embarrassed the Caroline Institute, so he got struck off, so they pulled the patient out altogether, and that patient now is blind. Now, Fernando Silves in Argentina had used my method, and he got it in the book, believe it or not, and he had that patient there that was going blind and blind, 3,000 units, definite embolism within the sort of ophthalmic artery, and he had that patient on day 4 could begin to count fingers, and then on day 5 to 6 he was improving. I think by day 14 he could actually see normally again. And then we had some patients in China, and we had them as well. So that, I don't know whether I have time to show it in this lecture, but I have a colleague, Dr. Hu Han, in Vietnam, And he has been doing catheterization through the internal carotid artery back up into the central retinal artery, and he's reversed now about 13 cases, if not all of them, at least some of them with partial restoration of sight. The problem is, well, if you leave it a bit late, you get contraction of the eyeball.
Yeah. And normally you see the choroid ring. It means that it have a blood on the eyeball and the central retinal artery in the optic nerve. So it protected by dura mater. So if you do retroposer only, it cannot infiltrate through.
No, we know.
Yeah. So we do the angiography. We put our microcatheter and you see the brain, but you don't see the choroid ring here, the eyeball. So the patient is blind.
You can't see it there.
You can see.
You watch what happens.
And then if you find the ophthalmic artery, we put the microcatheter.